Have you been feeling tired lately, dealing with strange symptoms, or just sensing that something in your body is off? If you're a woman and you've experienced recurring infections, constant fatigue, or unexpected changes in your skin or cycle, this video could change everything. Because today, I'm going to show you 8 hidden signs of diabetes in women that most people ignore until it's too late. These symptoms are often brushed off, misunderstood, or blamed on hormones, stress, or age. But they could actually be your body screaming for help. And if you catch them early, you might be able to reverse insulin resistance before it turns into full-blown type 2 diabetes. Let's start with one of the most overlooked signs: polycystic ovary syndrome. Yes, PCOS is a hormonal disorder, but behind the scenes, it's often driven by something much deeper: insulin resistance. When your body stops responding properly to insulin, it compensates by producing even more. And for many women, this overload triggers the ovaries to produce excess male hormones. That's why symptoms like irregular cycles, acne, or facial hair growth often appear together with weight gain, fatigue, and blood sugar swings. PCOS doesn't just affect fertility. It's a loud early signal that your blood sugar is already out of control. And that puts you at serious risk of developing type 2 diabetes. So if you've been diagnosed with PCOS, or you're noticing symptoms that match, you need to start looking at your blood sugar, not just your hormones. The second sign is something that many women dismiss or treat over and over again, without realizing the true cause: yeast infections. Recurrent yeast infections can be incredibly frustrating, but what many don't realize is that yeast thrives in sugar, and when your blood sugar is too high, some of that glucose spills into your vaginal tissue, creating the perfect environment for yeast to grow. If you're dealing with frequent or stubborn yeast infections that keep coming back or don't respond to typical treatments, it might not just be a hygiene issue. It might be your blood sugar. Your body is trying to eliminate the excess sugar through urine and secretions, but in the process, it feeds infections that wouldn't normally take hold. And here's the truth: many women live for years with insulin resistance or undiagnosed diabetes, treating yeast infections without ever realizing the root cause. If you've been stuck in this cycle, it's time to dig deeper. Because these signs, PCOS and chronic yeast infections, are not just isolated problems. They're part of a pattern of insulin resistance, hormonal imbalance, and metabolic breakdown that can silently progress for years. But here's the good news. Once you recognize the signs, you can take action and even reverse the process. The next signs we'll cover are even more surprising, and they often go completely unnoticed. So stay with me. The third one might shock you. The third hidden sign of diabetes in women is something you've probably experienced, but maybe never connected to your blood sugar: urinary tract infections. UTIs are common in women, but when they keep coming back, that's when you need to pay attention. When your blood sugar is too high, excess glucose spills into your urine. And sugar in your urinary tract is like fuel for bacteria. It creates the perfect breeding ground for infection. So if you're a woman experiencing frequent or stubborn urinary tract infections, especially ones that don't respond quickly to treatment, your body may be telling you that your blood sugar is out of balance. These infections aren't random. They're not just bad luck. They could be one of your first real warnings. And if ignored, things can get worse, fast. Let's talk about the fourth sign, one that shows up not in how you feel, but in how you look: skin changes, specifically a condition called acanthosis nigricans. These are dark, velvety patches of skin that often appear on the neck, underarms, groin, or other folds of the body. They may look like dirt or like the skin has thickened or darkened over time, but they're not caused by poor hygiene. They're caused by insulin resistance. When your body is overloaded with insulin, it triggers changes in the skin cells. They start multiplying faster than usual, and that leads to these patches forming in areas where the skin folds or rubs together. Many women don't even notice it, or if they do, they don't know what it means. But these skin changes are one of the earliest, most visible signs of high insulin, and a major red flag for prediabetes or type 2 diabetes. If you've noticed darkened areas on your neck, armpits, or inner thighs, and they've appeared slowly over time, it's not something to ignore. It's your body speaking to you, and it's time to listen. Now let's move on to the fifth sign, one that's less visible, but incredibly dangerous if ignored. Reduced sensation. Tingling, numbness, or even pain in your hands or feet can be a sign of something called peripheral neuropathy, nerve damage caused by prolonged high blood sugar. When your nerves are exposed to too much glucose over time, they begin to break down. You might stop feeling temperature changes or pressure. You might not notice cuts, wounds, or irritation. And that's where the danger begins, because when you can't feel pain, you also can't feel damage. And small problems can quickly become serious, especially in your feet. Reduced sensation isn't just uncomfortable, it's a signal that your nerves are under attack, and the longer it goes untreated, the more permanent the damage becomes. Many women assume these sensations are just part of aging or circulation. But if you're experiencing them regularly, especially along with any of the signs we've discussed so far, you need to check your blood sugar. These aren't random symptoms. Together, they form a clear pattern, a warning that your body's ability to manage glucose is slipping. And once you recognize that pattern, you can stop the progression. You can start healing. In the next part of the video, we'll talk about the final 3 signs, including one that most women experience but almost never link to diabetes. So stay with me, because the next one might be the one that finally makes everything click. The 6th hidden sign of diabetes in women is something almost everyone experiences, but very few people take seriously. Fatigue. Not the kind of tiredness you get after a long day. This is different. It's the kind of exhaustion that doesn't go away, no matter how much you rest. You sleep a full night, but still feel drained. You sit down to relax, but your energy never comes back. You're constantly fighting to get through the day. This is what happens when your cells aren't receiving the energy they need. Glucose is supposed to be your body's main source of fuel. But when insulin isn't working properly, your cells can't absorb that glucose, so the sugar stays in your blood, while your body runs on empty. That's why people with insulin resistance or diabetes often feel slow, sluggish, or heavy, even if they've eaten, even if they've rested, even if they're doing everything right. And for women, this fatigue is often misdiagnosed. It's blamed on hormones, menopause, stress, or parenting. But in many cases, it's actually a signal of metabolic imbalance, a sign that your body is starving for energy, even when there's more than enough sugar in your blood. If you're experiencing unexplained fatigue, and it's been going on for weeks or months, it's time to check your blood sugar. Because fatigue isn't just a nuisance, it's a signal. And so is the 7th sign, blurred vision. This one can be tricky, because it often comes and goes. You might notice it when you're reading or looking at your phone. You might rub your eyes, blame your glasses, or assume you just need more rest. But if your vision has been getting blurry, especially in short bursts, it could be due to blood sugar fluctuations. Here's how it works. When glucose levels rise too high, it pulls fluid from surrounding tissues, including the lens of your eye. That affects your eye's ability to focus properly, and the result is temporary blurriness that appears without warning. Some women describe it as cloudy, or like a film over their eyes. Others say it feels like their vision is off, even though they're not tired. Whatever the case, blurred vision caused by high blood sugar is often reversible, but only if you catch it early. Left unchecked, chronically high glucose can cause long-term damage to the blood vessels in your eyes, and that can lead to permanent vision problems. So don't ignore this. If your eyesight is changing and you don't know why, your blood sugar could be the reason. And now, we come to the 8th and final sign. One that almost every woman notices, but very few connect to diabetes: frequent urination. If you find yourself going to the bathroom more often than usual, especially at night. This could be a red flag. When your blood sugar is high, your kidneys try to filter the excess glucose out of your body. But there's a limit. When they can't keep up, your body starts flushing sugar out through your urine. And that means more trips to the bathroom, more dehydration, and more thirst. It becomes a cycle. High sugar leads to frequent urination, which leads to increased thirst, which leads to drinking more water, which leads to even more urination. It may feel like your bladder has suddenly gotten smaller. But what's actually happening is a massive internal effort to get rid of the sugar your body can't handle. If you've been getting up at night more than usual, or feeling like you constantly need to go, even if you haven't had much to drink, it might be time to look deeper. Because these 8 signs together aren't random. They form a clear, undeniable pattern. A pattern that your blood sugar is rising, that insulin is no longer working the way it should, that your body is trying, quietly, patiently, to warn you before things get worse. Now that you've heard these 8 hidden signs of diabetes in women, I want to ask you something. How many of them have you felt? How many have you ignored, brushed off, or explained away? The truth is, most women go months, even years, without realizing what's really happening inside their body. They treat the symptoms, but not the cause. They blame their hormones, their age, their stress levels, but never stop to ask the deeper question. What if your body has been warning you all along? Diabetes doesn't usually appear overnight. It builds slowly, quietly, until one day it's no longer silent. That's why recognizing these early signs, especially as a woman, is one of the most powerful things you can do. Because early detection means you have a choice, a chance to take back control before the damage becomes permanent. These symptoms aren't just random. They're connected. They point to one core issue: insulin resistance. And the good news? Insulin resistance is reversible. You don't need to wait for a diagnosis. You don't need to live in fear. You just need to start paying attention. Because your health isn't about perfection. It's about awareness, action, and small changes that build real momentum. And if you're ready to take that step, you don't have to do it alone. Thousands of women are already lowering their blood sugar naturally, without medications or extreme diets. If you want to discover how they're doing it, the solution is waiting for you in the link in the description. Don't miss it. If this video helped you, please like it, leave a comment, and subscribe to the channel. We create science-based, natural strategies to help you reverse type 2 diabetes, balance your blood sugar, and protect your health. One smart choice at a time. You deserve answers. You deserve energy, clarity, and freedom. And it all starts with understanding what your body is trying to tell you.